Let's go into some real core numbers here you need to be aware of. I'm going to touch just a little bit on the marketing and the market opportunity. If you can't see an opportunity, you'll never be able to access it. Okay? 87%, and this is from the Insurance Research Council, 87% of the auto injuries have a soft tissue component. 87%. Now that's good for chiropractors. Only 32% have a disc component. That means 2/3 do not. Only 16% have a nerve component. And by the way, while I'm saying this, and I'll get into it in much greater detail when we go into marketing, because they don't need you for a disc. You're not the authority with a disc. The orthopedist and the neurosurgeon is, not you. And so that's why you never want to compete with something that you're branded as not being the authority in. But you are the authority, or can be. You're not the authority, but you can be the authority in the soft tissue category. You're not. If you were the authority, they'd be calling you right now. But they're not. But you can, and here's the great news. The neurosurgeon, the orthopedist, will never outdo you, will never be an authority over you. I'll get on the stand, talk about the soft tissue injury. An orthopedist, neurosurgeon, neurologist will never be able to compete with me. I'll run circles around them. Just like they'll run circles around me talking about surgery. See? So one of the things we'll learn is the gateway is to go in is the soft tissue injury. Once you develop their trust, then it'll expand into the other categories. As a matter of fact, one of the most common things that'll happen when you learn the educational sales part, the documentation plus the educational sales, this happens quite frequently. The attorney will ask you to be their expert witness for their other cases. That's what'll happen. Has that happened to Dr. Matt yet? You don't know him? It'll happen quite frequently. And the reason it will is because they'll see that you know how to put the whole case together. That's what'll happen. And that's what you want. You want to be the quarterback of that case. You want him to be dependent on you to know what kind of a case he does or does not have. So 16% is nerve injury. They don't need you for that. That's a neurologist. 10% is mild concussion. Has the population been trained to go to a chiropractor for mild concussion? No. That's a neurologist. 2% are fractures? No, it's not chiropractic. 2% of the population are in car accidents annually. Take your geographic radius of draw. Multiply that, whatever that is. Like in that one lady, she had 100,000 within her geographic radius of draw. 100,000 people. Multiply that times 2%. That's your potential personal injury cases right there. And then take away a third of them. Let's say we're going to give the disc, the nerve to the orthopedist, neurologist because they don't need you. That's 2/3 of the cases. The majority of the cases are for you. There's a lot of opportunity. And 80% of the cases are under 20 miles an hour. What's that called? It's called phenomenal opportunity. And here's the last piece of the puzzle. It's a forced market. They have to send them to healthcare providers. You don't even have to be that good at sales. They have to send them somewhere. It's fantastic. It's unbelievable. Not if you can see it. Not if you can't see it. That's like chiropractic. Only 8% of the population utilizes chiropractic. 92% do not. Does that mean they don't have a typical gateway chiropractic problem? No, not at all. They're just not looking for you. So if you don't know how to access that 92%, you're stuck with 8%. That's a small number, and that's why most chiropractors don't do well at all. When you do know how to access, 3 out of 4 of that 92% has a chiropractic problem. Back pain, neck pain, headaches. Those are the gateways to chiropractic. That's 84 to 91% of why somebody will go to a chiropractor. That's a lot of potential people. You got more people driving by your office every day. The second leading cause of going to a GP is back pain. You got more new patients driving by your office going to the local general practitioner than you have coming into your office. There's a huge opportunity if you know how to tap into it. The second leading cause of going to the emergency room, back pain. Second leading workers' compensation injury, back pain. Joint pain is the number one reason for the number one medication drugs being sold, over-the-counter NSAIDs. Joint pain. So there's this massive amount of business out there. Chiropractors don't know how to touch it because they don't know the difference between publicity, advertising, and educational sales. And publicity and advertising, and you will, by the time we're finished, you will know. And so when you use advertising and publicity, it won't work, and you'll see why it won't work. But educational sales works exceptionally well when you know it. And that's how I was able to open 77 offices in 20 states, seeing over 30,000 new patients. I can create more business than I physically can handle every day and every night. It's not because I'm doing Facebook ads for the 8%. That is not why. It's because I know how to go to the 92%, and I know how to do educational sales with attorneys and patients and bring them in left and right. Then I know how to keep them. And that creates a ton of business. Next thing you better learn how to do, learn how to hire, train, and manage associate doctors. That's a fact. Okay. So these are the market leaders. Fracture, orthopedic surgeon. Does the attorney need you for that? No. Mild concussion? No. Neurologist. Nerve injury? No. That's a neurologist. That's not a chiropractor. Now, if you develop a personal relationship, that's different. I'm talking about branding, what you're known for in the community, the real world. Soft tissue injury? No. You're not the authority, but you don't have competition. The gate is open. That's the gate. That's the way in right there. Never compete who already is the authority. That's a rule in marketing, you'll see. Focus on the open market. Tremendous. You realize 75% of the attorneys don't even use chiropractors? Kind of like 92% of the population does not even use chiropractors. 75% of the attorneys do not even use chiropractors. You know why? The same reason the 92% don't use chiropractors. They're confused. They don't know what you do or don't do. And they've seen some of your notes. They want nothing to do with that. They can't have a chiropractor in court testifying, talking about how they help cancer, asthma, allergies, and the immune system. Because that'll destroy a jury. That'll destroy normal people. That's called one hell of a paradigm shift is what that's called. That's why. Fortunately, we can overcome that. But there is a small percentage you won't be able to overcome because they've already been branded wrong. Just like the percentage of there's a certain percentage of the population out there. You have a 67% negative name recognition. Why? That's why you're not being used by 92% of the population. That's why you're not being used by 75% of the attorneys. You know what percentage of the cases, personal injury cases, are used by chiropractors? 32%. Well, wait a minute. If 8% of the population go to chiropractors, but 32% of auto injury cases go to chiropractors, what does that tell you on the surface? What does that tell you? It tells you I got a lot more potential over here, doesn't it? If it's only 32%, but 2/3 of the cases are soft tissue, how much potential is there? It tells you we got a huge upside here, number one. Okay? What else does it tell you? Did that 32% go to the chiropractors on their own? No. They had to have an attorney to send, because only 8% would naturally go on their own. They had to have an attorney. They had to have an attorney send them. So there's a huge opportunity